Worried that you might have an STI and don't know what to expect? We're going to walk you through what testing and treatment is like. The first thing to do if you're worried about having an STI is stop having sex, and then go get tested. The logistics of STI testing and reporting can vary from state to state, but in every 50 states, there are a set number of STIs that need to be reported to the health department. So if you do go get tested for STIs, you should know that your doctor or the lab will likely report some findings to the health department. From there, the health department will contact you to do sort of contact tracing, or asking who you've been exposed to or had sex with, so that they can also share with those people that they might have an STI. Keep in mind that this is confidential, so they will contact you, but then they'll reach out to your partners and say something like, "Hi, this is the health department. You have been exposed to chlamydia. Please go get testing and treatment." But they will not share your information. It is all kept private. The reason that the health department does want to know about certain STIs is because we really do want to reduce the spread and transmission of STIs in this country. And so figuring out who has been exposed and treating those individuals is the fastest way to reduce the numbers of STIs in America. When you learn that you have an STI, there are a few things to know. Specifically, that there are a few different things that cause STIs: bacteria, viruses, and parasites. Bacterial and parasitic STIs are curable, meaning that we can generally provide either an antibiotic or an anti-parasitic medication that completely takes that infection out of your body. Bacterial STIs include things like gonorrhea or chlamydia, and parasitic infections are things like trichomonas and pubic lice. When it comes to viral STIs, the strategy is a little bit different. Viruses are not technically curable, meaning we can't erase them from your body, but we can do things that make them very manageable. Things like herpes we usually manage with symptomatic flares. So when you have a flare-up, we can treat and reduce the pain and the risk of transmission to a partner. Other viral STIs, like HIV, we manage with daily suppressive medicines, meaning we give a medicine every day that reduces the virus in your body and reduces the risk of transmission to a partner. HPV is a virus that's a little bit more complicated to manage. It depends on the manifestations or how the HPV shows up in your body. HPV can cause genital warts, which can usually be managed by freezing or treatment in your doctor's office. But HPV can also cause things like cervical cancer and oral and throat cancer. And the management of those, as you can imagine, is a little bit different. When it comes to HPV and cervical cancer, that's the whole point of pap smears. We do pap smears on a regular basis to women over the age of 21 to check if there's any HPV on the cervix. From there, if HPV is detected, it can either be removed, or if it has become cancerous, then we treat the cancer. When it comes to head and neck cancer or oral and throat cancer caused by HPV, the treatment is a little bit different, and it often looks like cancer treatment. But the good news is that we have a vaccine that prevents a lot of the cancer-causing and genital wart-causing forms of HPV. The topic of herpes in particular as a viral STI is a little bit complicated. Many people have cold sores, which technically is caused by a type of herpes. There are two major strains of herpes, HSV1 and HSV2. HSV1 is the one that usually causes cold sores. HSV2 is the form that usually causes genital herpes. However, it is possible, especially with oral sex, to spread HSV1 or cold sore type herpes to the private area. And it's possible if performing oral sex on someone who has HSV2 or genital herpes that you can catch that type of herpes of the oral region. Technically speaking, cold sores are not considered a type of sexually transmitted infection. But if the cold sore is transmitted during sex, it would be considered a sexually transmitted infection because it was transmitted during sex. There's an important thing to know about any type of herpes infection, is that even if there's not an open sore like a cold sore or a genital sore present, it is still possible to spread herpes to your partner. So the risk is higher when you do have a cold sore or a genital sore, but herpes lives on the skin, whether you have an open lesion or not. So if you do have herpes, it is best to share that with a partner. There's a lot of confusion about what counts as a cold sore and what is a canker sore. A lot of people get canker sores. Canker sores are generally on the what we call mucosal surface, so inside the mouth. They can be on the gum line or on the lips, and they're generally very painful sores that can come up when someone is stressed or if they eat a lot of sugar. There are a variety of factors that can cause canker sores. The difference between a canker sore and a cold sore is one, the cause. A cold sore is caused by herpes or HSV1. Cold sores are generally located more on the exterior part of the lip, so on the lips, on the corners, or around the oral surface. The diagnosis of herpes or a cold sore can be done in your doctor's office with just a skin scraping of the cold sore or the open lesion. A cold sore is something that will recur throughout someone's life. It usually starts as a bit of a tingling sensation around the area where the cold sore will eventually develop. Then when the cold sore develops, it becomes very painful. A diagnosis of herpes is helpful because there are some specific medications that we can give if you start to feel that tingling or the start of a cold sore coming. You would usually start taking the medicine at the start of that tingling feeling, and that reduces the painful development of a cold sore significantly. I hope you found this video helpful. If you want to learn more about sexual health, subscribe to our Julie channel. Thanks for watching.